You all been reading about Bill Paxton, a wonderful man who I had the pleasure of knowing. He actually was in a film with my wife, so I can tell firsthand that he was a superb valve that wasn't made quite right. And for that reason, it set him up for some problems. So I have the death certificate here, which I'm interpreting. I called over to my colleagues where the surgery was done. It was a very high quality center in Los Angeles called Cedars-Sinai. And just to sort of clarify what's going on. To be clear, when you open someone's chest and stop their heart, which is what needed to happen with Mr. Paxton for surgery, there's a risk involved. And the mortality risk of changing the aortic valve itself is just under 1%, but his problem was bigger than that. According to the autopsy report, this valve in the middle of his heart, it's called the aortic valve. Right there, you can see the three of them. It connects the major chamber that pumps the blood. Well, see this thick muscle? That's a big chamber called the left ventricle. And it connects the pumping chamber of the heart to the aorta, this tube that comes out of the heart and carries blood up to the brain, the kidneys, and the rest of your body. So looking inside that tube, if this valve, instead of having three parts, 1, 2, 3 parts, supposed to be shaped like a Mercedes-Benz sign, instead of it only has two, so so-called bicuspid valve, which again is present to, let's say, 2% of the population, or roughly, then that valve, the degeneration causes the blood coming out of the heart to push against this tube and makes this tube grow into a large aneurysm. It also turns out that people who are born with an aortic valve that's not made right often lack some of the material inside the aorta that makes it stiff. So this tube is weak, and it also is responsible for it growing. So surgeons will replace the tube, the aorta, as well as this valve. And when you do both together, it increases the risk to a few percent. There's also significant morbidity that can occur. The next place the blood goes once it leaves the heart is to the head. So if any small materials around the valve that you've replaced, then it can flap to the head as well. We suspect as heart surgeons that's a risk that we explain thoroughly, but even if it's 1 to 2%, if you're one of those 1 or 2%, for you it's 100%. So that's the problem with statistics. It's not that you have a 98% chance of not having a problem, it's that you have 98% chance of getting a perfect result and a 2% chance of getting a very bad result, which is what may have happened with Mr. Paxton since he appears to have had a stroke after the surgery. It's a known complication of the procedure. It is still the right thing to replace the valve and the aorta coming out of it, because we know patients will die from the aorta rupturing or from problems related to the valve, because it will destroy the heart if it's not fixed in time. So it's an unfortunate outcome, and I feel badly for the family. It is an opportunity for folks to learn a bit more about an abnormality that's present in more of us than we expect.